Today I'd like to discuss weight loss injections and liposuction, how they work, who they work for, which is better, weight loss injections or liposuction. My name is Dr. Mike T. I'm an aesthetic consultant in Harley Street Skin Clinic. I've been doing this work now for 25 years. I trained at St Andrews University and Cambridge University. I have a background in ENT surgery, general medicine, general practice, and aesthetic medicine. I specialise in all forms of injectable treatments and all forms of minor surgeries such as earlobe refashioning, removal of moles, skin tags, lumps, bumps, and everything else. So the weight loss injections, as you're probably aware, are things like semaglutide, which is Ozempic and Wegovy, and tirzepatide, which is Mounjaro. The advantages of these injections is they're easy to administer, they can be done by the patient at home, they're done once a week. Patients are monitored by us in the clinic so we can advise on dosages and everything else. Liposuction is more invasive. We would define it as a minimally invasive surgical procedure, and it's probably better for body contouring and sculpting rather than looking at large areas of weight loss, although it can be used for that. So we see a lot of patients for weight loss injections. Often patients have a good diet, they exercise regularly, but they've hit a brick wall as far as losing weight is concerned. And they want to know, will the weight loss injections help them? And the answer is, yes, they will. Mounjaro is actually a stronger medication. And for those people who are larger and want to lose more weight, Mounjaro probably has the edge. But the basis of the treatment is we check height, weight, body mass index, blood pressure, and organise routine blood tests. We then show patients how to do the injection, and we do the first injection. Patient goes away with 4 weeks of injections and then comes back on a monthly basis so we can monitor weight loss. So far, I've not met anybody that hasn't lost weight with these injections. The important thing is to have somebody like me taking clinical responsibility so we can make sure the weight loss is not too dramatic and that it's gradual, steady, but progressive. And we can then monitor the dose and either increase the dose or stabilize the dose. The weight loss generally is an overall weight loss. So you don't get any weight loss in specific areas, you just lose weight. If we then turn to liposuction, these days liposuction is used for body contouring. So we get a lot of people coming in with fatty areas under their chin and you just can't get rid of it. And if you lose weight, even with the weight loss injections, those stubborn areas of fat just stay there. They're the last bits to go. Now that is where liposuction comes into its own. So we do procedures called body tight, face tight, neck tight, which is radiofrequency assisted liposuction. The advantage of this is, A, we can target specific areas. So we can just do under the chin or the neck or the face, or we can do any other areas of the body. We can do lower abdomen, upper abdomen, bingo wings, brass band. We can pick out areas and we can physically remove the fat with liposuction. But more importantly, we add skin tightening to the procedure, which is a radiofrequency skin tightening. Nobody wants the fat to be taken away and left with lots of loose, wobbly skin. With radiofrequency assisted liposuction, that doesn't happen. Over a period of 3 to 6 months, the skin tightens so that it looks really natural, like you've never had fat removed. And that's what people want. You don't want baggy skin, so you think, oh, you know, you've had liposuction, that hasn't worked very well. We want you to look good after the procedure. And with radiofrequency assisted liposuction, that is what happens. I'm frequently asked about side effects and downtime relating to weight loss injections and liposuction. So let's talk about the weight loss injections first. What side effects can happen, what are likely to happen, and what are the rare side effects that we hope never happen? The commonest side effect that I see is nausea. Doesn't matter which weight loss injection one uses, nausea is quite common. It usually lasts 24 to 48 hours and then settles. Occasionally, some patients get vomiting, but again, it does settle very quickly. Diarrhea and constipation are also reported, and an increase in acid reflux, but they are less common and they don't seem to cause too much trouble. A rare significant complication side effect is acute pancreatitis. Fortunately, touch wood, I've never seen that in all the patients we've treated, but I am aware that it can happen, and we do have to warn patients about that. The advantage of the weight loss injections is that they are non-invasive. They are very easy. And apart from the side effects I've just mentioned, there are very few other significant side effects. With regards to liposuction, it's a minimally invasive procedure. It's done under local anaesthetic, and you do need a little bit of medication preoperatively just to calm the patient down. So normally we give a dose of diazepam, and then we inject the area that we're going to do the liposuction on with local anaesthetic. So what side effects are there for liposuction? Well, bleeding, bruising, infection, scarring, asymmetry. Bleeding is usually localized and doesn't last very long. Bruising, I'll be honest, is usually significant, and I'll just talk about that a bit more in a minute. Infection is uncommon but can happen. Everything is sterile. We like to keep it that way. And most patients don't need regular antibiotics, but if there's any concern, if an area is getting hot, red, swollen, we would give antibiotics straight away. When it comes to asymmetry, we're very careful with what we do. We have a lot of experience with liposuction. We know how to do it to minimize any asymmetry. So what can patients expect after the procedure? Well, in week 1, you're going to be bruised, swollen, and in discomfort. You will need paracetamol. You may need a little bit stronger, such as cocodamol. In week 2, the discomfort usually goes, but you are still left with bruising and swelling. In week 3, the swelling is pretty much gone, but there is residual bruising. By week 4, you're now beginning to see the benefits of the procedure. You can't expect to see a benefit up to week 4, but week 4 you will see an improvement. And then week 4 to week 12, which is 1 month to 3 months, you see a significant improvements as that radio frequency skin tightening really starts to kick in. And you do see a good improvement by 3 months. There's continued improvement and benefit from 3 months to 6 months, but it's less than in the first 3 months. And at 6 months, you really do have the overall benefit. If at 6 months things are not right or a patient is not happy, then that's when we need to discuss what the options are moving forward, because it's unlikely to get any better after 6 months. So I hope that's been helpful. Next step, book a consultation, come and see me.